It's gonna be a good one.
It's gonna be a good one.
Definitely a different type of process.
Cut down or freeze up.
Being a coach's son.
Jackson, of course, they keep retooling. One stone to face, a hit by pitch. Oh my goodness.
Hey, welcome back to Baseball 101. I'm Darin Sissel, still. If you've been watching before, I have not changed. So the things that have changed are the guests. And this week we do have a different guest. Last week was Kevin Mulder. This week, Ben Hendrix. So if you don't know Ben, hopefully today you're going to get a chance to learn about Ben, what he does. And honestly, without Ben, my son would have had all kinds of issues. I still wouldn't be sleeping. There's a lot that goes into that, but we'll get there. So Ben's actually, he runs Tross over there off Highway N. Is it in?
Yep.
It is in. I don't know my roads, but been there 10 years, chiropractor, sports rehab. So we're going to get into a lot of the things that he's done for me, my family, what I've seen him do for athletes, and hopefully educate you a little bit on kind of what chiropractors do, and especially as it relates to soft tissue and some of the stuff that I don't think people really understand they do. So anyway, just to let you know, I mean, I've known Ben, I don't even know, years. It's been years. It's been a while. I went to him. He was helping me out. And then my son, when he got to be ninth grade,
Eighth grade, we started working with Ty.
Eighth grade, he did start out with screening. What are those things called?
We took him through an FMS and SFMA screening, and it's just a functional movement screening.
There's a lot of letters. Functional movement screening, FMS.
That's right.
I have not known that all these years, but FMS, functional movement screening, which I do know that at the MLB Combine, he had to go through. That was the same screening he went through, right?
It came full circle, yep.
So where he started in 8th grade, what Ben put him through in 8th grade to check. What are you checking for in those things?
So you're really looking at an athlete top to bottom. So you're looking at the body's ability to move basically in each region. How do they move through the cervical spine, the shoulders, the thoracic spine? Can they stabilize through the lumbar spine? Are their hips mobile? Can they disassociate certain areas? And it's really looking at, okay, how are they moving? And are there any areas of deficiency? And will that deficiency, does it have a probability of leading to an issue for that athlete, or is it hindering their overall performance? And so we could get real into the nitty gritty, but it's basically looking at the athlete from bottom to top, how they move, and what can we do to aid in them for injury prevention and also performance enhancement.
So more on you get assessment to make sure you can prevent future injuries, hopefully.
That's a big part of it. Yeah.
So do you recommend a certain age? I know we did that with Ty in 8th grade, kind of going to high school, because I know he was getting ready to start lifting weights, and I want to make sure that there were no deficiencies that need addressed. Is that typically like right before puberty, right around puberty?
That's a great time. Some practitioners can argue earlier than that. I think developmentally, if we can get an athlete to 10, there's some argument there. But you're going to see the most bang for your buck typically in that 7th, 8th grade, depending on how fast they're maturing and before they hit that high school threshold.
Yeah. So let's go back a little. We skipped over, obviously, your background. Again, obviously, I know this, but
yes,
you grew up playing sports, baseball. You played football. We were talking about McClure North when McClure North was dominant back in the glory days.
Yeah.
And then I know you told me a story kind of why you chose to be a chiropractor. You kind of shared that story.
Yes. So athletically, my background, I played football and baseball. Basically was doing it from the time I could see my older brother doing it, but I played football and from the age of 6 on, and I started playing baseball at probably 5 or 6 on. In high school, I was a 3-year letter varsity in baseball and football. So I played quarterback on the football team, and we were kind of an option team until my senior year. Then we kind of went run pass, but then in the baseball, I was a shortstop and a pitcher until that became too much for my arm. Then I kind of shifted to second base.
Yeah.
But that's kind of my athletic background up until that point. I had a couple offers to play football, but I was a little beat up, and I ended up going to Forest Park Community College to play college baseball for 2 years.
Mason Horn, right?
Mason Horn was head coach there. So
good guy.
I wouldn't have called myself a key or even a regular starter player on that team, but I'd like to say I contributed in some sense. But seemed like at that point my body and my athletic drive had kind of started to diminish, and I was really getting into my schooling and what I wanted to do. And everybody else around me was still getting better, and I wasn't. So that's where my athletic
awareness
career
of limitations is important.
Yes. I think I was more of the second athletic trainer than I was any position on that baseball team. But I felt like I contributed in some way.
Well, at the junior college level, the amount of times that we were taping each other's ankles or whatever, that was just part of the JUCO world at the time.
Yes, that is.
So how did you decide to pursue chiropractics?
So I remember it vividly. We were playing Rittner, and we had called basically a rollout right pass. Not to demean anybody, but we were kind of at that point in the game where we were going through our entire playbook. I was kind of running 2-minute drill at that point in the game, and rolled right. Linebacker made a great read, came up. When I threw it, my elbow hit his helmet. Immediately, my elbow blew up. It was 3 times the size that it was. So I was pulled out of the game, and as you mentioned, I had a lot of great athletes, some very high-level football athletes around me at the time, so our team had attracted quite a team, not to be redundant, but we had an orthopedic that came to every game with us. Logan University brought a team of students to come to the game. We had a team chiropractor, and then we had a team, I believe he was just like a general practitioner. Yeah. And so you got amazing care, and you got a lot of opinions on certain injuries, and I kind of went down the line. The next week, we were playing our rival, Hazelwood Central, and the majority of the consensus of everybody except for the 2 chiropractors, Dr. Laney Nelson and Dr. Kevin McLean, the chiropractors kind of sat back and let everybody else give me kind of my options at that point. And I'm fast forwarding through about 24 hours here, but the orthopedic evaluation was 3 weeks, anti-inflammatory, rest, ice, compression.
Yeah.
Basically, that was the consensus among everybody except for the 2 chiropractors. Dr. Laney Nelson said, "Can you meet me at school?" We played on Saturdays typically, but he met me at Saturdays. "Can you meet me at school tomorrow on a Sunday?" And I said, "Of course." And he came up to school, treated me. Dr. McLean treated me Monday, Tuesday. Dr. Nelson treated me Wednesday, Thursday. And this is not like a miracle story, but from the treatments that they were doing, I was throwing better Friday than I was throwing the week previous, or Saturday when we played Hazelwood Central. I was moving and throwing better than I did the previous Friday. And I said, whatever these 2 guys do, I want to know more about it.
Yeah.
And then my head football coach, Jim Schottmuller, had a program called the Community Learning Program. So the second half of my junior year, I went into Dr. McLean's office as an intern, a high school intern, and I did that all the way through my senior year. So I got to see not only this really cool case of my elbow, but then I got to see the day-to-day and what he was doing for patients and athletes. Yeah. And it was amazing. I was like, that's what I want to do.
And I think that was, I know for me, I did not know until really going to Tross that like chiropractors just aren't there to adjust your back. Like I thought that was the only thing. Like I would have never thought of, hey, I have an issue with my elbow or ankle or like soft tissue. So I didn't know that. I didn't know chiropractors did that. It was pretty much, hey, my back's kind of hurting. Can you adjust it? We move on.
Yep.
Which is definitely not what I've experienced, obviously, working with you and what I've seen with Ty. A lot of things that you guys do are completely new. So, and I think that's for a lot of people that have this notion about chiropractors only working on back and neck, it kind of limits their ability to find a good chiropractor. They assume that all chiropractors just want to pop your back and that's it. And so if someone's looking for a chiropractor, like what should they be looking for that's as far as what treatments are typical to someone that's kind of a high quality, not that anyone's doing anything wrong, but if you're trying to seek out a best fit for you, someone that's going to do more than just pop your back, like, are there things people should be considering when looking into chiropractor?
Yes. And man, it's a big answer. So I'll try to condense it. What we've done, I would say not well as a profession, is we haven't conveyed to the public that chiropractors have different specialties and areas of focus. And that if you are looking for sports injury treatment, going to a general chiropractor or somebody who may deal more with nutrition or women's health is probably not going to be the place for you.
Yeah.
And you're probably going to get very different treatment and thoughts on that issue that you're having. And sometimes it won't even be addressed, or it will be brought back to an area of the spine, and the spine then is only treated. And if you have an extremity issue, it might not even be addressed.
Yeah.
And so in this world, I would say you need to look for a chiropractor that is movement-based, someone that is offering kind of a multifaceted approach to treatment. So manipulation is key. That's the thing that separates us, I would say. But then there has to be added things onto that. Soft tissue treatments, movement-based therapies, or at-home exercise. We have to look at the body as a whole, and we have to look at the tissue from its entirety. Can we treat the tissue? Can we get that area moving? Why is that tissue undergoing stress? Yeah. And then can we load it at that point? Can we create some space to start loading and strengthening it to make sure this isn't a repetitive issue? And so there's a couple of keywords I could throw out for you guys if you're looking for a chiropractor, but movement-based. They'll have some certifications like FMS, SFMA, TPI. Somebody that does Graston, dry needling. Is going to have some kind of adjunctive therapy to help, laser therapy, shockwave therapy. There's these different things that can help, but find somebody that has a movement-based approach. That is the number one thing I would tell patients to look for.
So over the course of, like, you mentioned dry needling, and I've got to experience a lot of these different ones. Like the tissue, the soft tissue is, when you can treat that, it helps with alignment, it helps range of motion, it helps all these things. And I think that was one thing that I was shocked that, like, I had obviously, I keep saying obviously, they don't know. You know. You don't know. Maybe you do know. I don't know. I've had nerve issues, my neck and shoulder, and it wasn't until a lot of the soft tissue work and the cupping and different things that you were doing that it really gave me some relief, and it helped me out. And it wasn't just, hey, come in and manipulate my neck and then all of a sudden I'm good. It was the underlying soft tissue stuff. Like, it seems like you work on soft tissue more than you do actually, like, the manipulation of, like, the spine and the neck. Is that accurate?
I think it depends on the patient, and that's where we hammer home weekly. We are not a rack 'em crack 'em, and everybody gets different treatment in our offices.
Yeah.
So it goes down to the individual. Some individuals need a lot more of the soft tissue addressed so that we can then manipulate or get the movement that we want in the spine, in the shoulder, wherever we're talking about. Some patients, not as much, but almost every patient in our office is getting some soft tissue-based treatment, along with kind of a joint-by-joint approach on manipulation, stability. They're getting advice on, okay, we need to do this to stabilize the core so that we can disassociate the hip. You're getting this to mobilize the T-spine so that your neck is not the constant issue. But now let's address what we see in the moment. Do we have tissue that is tight? Do we have tissue that is painful? We call it sensoromotor. So is the sensory not having a great time, and is the motor portion not having a great time? So those are the two areas we're going to address with soft tissue. And once we're able to decrease a patient's pain threshold from the sensory aspect, and we're able to increase gliding or decrease tone of that muscle, we've now got some room to work with. The manipulation is going to have more benefit. We're going to get a joint to in range better. I feel like I'm kind of getting into the minutia here, but it helps the patient if we address all of the anatomy.
So I know a lot of the athletes I talk to, if they have an issue, they go see orthopedic surgeon or they go see, and typically they send them to PT. Like, I know I've been to PT a lot. So I've had surgery, and there's nothing wrong with PT, and it's helped me in a lot of ways. But it also, they approach things differently than what I've seen with you. Like, can you just kind of sum up the difference between, like, if someone has a hamstring issue, going and seeing a PT compared to seeing you, like, what are the benefits? What's the differences between those two?
So, from the majority, from a chiropractic at my office, you're going to get a lot more hands-on approach inside your treatment. So, we're going to be trying to treat that soft tissue, trying to load it to do the things we just said. We want to try and decrease its pain and increase its ability to do its job. So a lot of what we do is pro-inflammatory. So we're trying to help the body from a cellular level speed up that recovery process as much as possible. But then there is a portion of it that we have to then load or give exercises to get that muscle back strengthened to get to that point. But the main thing, the difference there is at my office, you're going to get a very hands-on approach, very pro-inflammatory approach to the tissue itself. And at the PT office, in generalities, you're going to get exercises to start loading that tissue or trying to strengthen around that area in the beginning, because most of the times they're not
as aggressive.
Yeah, they're not as aggressive. They're not going to load a strained hamstring. So they're going to try and strengthen around that area with exercises. So you're going to have an hour of overwatched exercises that typically are starting in a very low threshold standpoint. And then you're going to progress while that tissue gets a little better. Then you're probably going to get into some things to strengthen the hamstring. So your approaches are exercises to try and strengthen the tissue or the tissues around it to help the area. Ours is more of a hands-on approach where we're utilizing manipulation, soft tissue, Graston, cupping, trineedling to try and stimulate the body to heal that tissue as quickly as possible, and then we start loading it. That's the two biggest differences.
So like with your elbow, they were going to give you 3 weeks out anti-inflammatories.
In PT, yep.
So you went chiropractor and you were back in 5 days.
Yes.
And that's what I think, from what I've seen, like with my son, when things would flare up, you were able to aggressively treat that to where he was back on the field. Like I mean, my son set the record for consecutive games played in Missouri, like over the course of his career. Like I don't even know how many games he played, but a big part of that was, one, he was seeing you to prevent things, and two, every time someone would flare up, he was working with you to work through those things quickly, because over the course of 4 years, he had some things that came up that if he would go into a doctor or orthopedic, they probably would have sat him for 2 to 4 weeks, and he was able to play through. And obviously, at no point are you risking injury.
Right.
You're just treating it differently. And I think that's one thing that I really wish more people understood. If you have something that's like shoulder issues with baseball players, they're common. Do you see more elbow, shoulder? Like, have you seen any trends with like injuries with that stuff?
Younger, I probably see more elbow. The diagnosis of little leaguer elbow comes in a lot.
So what age are you starting to see that stuff?
Crazy young, 8, 9. And then we'll see.
So is that mostly from overuse?
So that's a great question. That's probably a great one to get into. With these individuals, it's not always the same thing across the board. I wish there was one thing that I could give you guys a nugget to take home today and be like, do this to prevent little leaguers' elbow. What we tend to see is lack of stability in that age range. So they typically are very mobile at that age range.
Yeah.
And they don't have the stability or the scapular health to have proper mechanics to actually throw the ball as many times as they are throwing it. And sometimes the coaches are doing a great job of, I would say, load management. But unfortunately, even the best load management does not combat faulty movement patterns and asking the kid to do a motion where he doesn't have the stability to do it in the first place. And then we start to see compensations from there. We start to see the shoulder be extremely tight. And so everything they're doing from the mechanics of pitching or throwing is loading that elbow. And so we look at those individuals, we talk a lot about proper joint by joint approach mechanics and having the ability to move properly through what you need to do to throw a baseball.
Yeah.
And so that we don't consistently injure one area of the body. If we have a patient that comes in and the mom or dad is like, he's always injuring this area of the body. Okay, we need to figure out why. We don't need to just treat that 4-inch by 4-inch area.
Yeah.
We've got to go globally and figure out, okay, why is little Johnny always having stress at this area, even when mom and dad are load managing and the coach is load managing? Why is this happening? And that's where I think sometimes these kids get left because it's not an orthopedic issue. They're the big dogs. They get the big dog things. But most of what people come into our office with are very repetitive stress injury or faulty movement caused by faulty movement patterns. And the tissue just can't handle doing something it's not meant to do, if that makes sense.
So if that's 7 to 8, and I'm not sure. I think that's when kids start pitching.
Yeah.
Like coach pitch stops around, 5, 6, something like that. So kids are starting to pitch. And if they don't have the proper mechanics, it's putting stress on joints when they're not ready for it. Then you start getting inflammation within those patterns.
That's exactly right.
So essentially, coaches either need to be teaching proper mechanics, not that some coaches do a great job. So it's either poor mechanics or they're doing it too much.
Yes. And, to have an individual assessment on somebody that's having that, most kids, it's not the vast majority of kids, but the kids that continually have that, they need to get to somebody to have a movement-based evaluation to figure out why that's happening, because all their body is going to do is get stronger. And as we all age, and especially we're talking about baseball males, they're going to naturally get stronger and tighter as they get older. And so what is that issue going to look like when they're a sophomore, junior, senior in high school, and they're able to generate 85 to 90 from the bump, and now the body just can't, it's adapted so many times. And that's where you see these high school athletes where an ounce of prevention would be worth a pound of cure. Like if we just prevented it earlier and started to make some changes, there would be a lot less of those outcomes.
And I think that's a big part of, if they can get with a chiropractor, get comfortable with them, let them know, because obviously you're going to know your patients well. And if you start seeing patterns of issues within a certain area, you can prevent those things. And I think that's why we did the screening with Titus in 8th grade, was if we can prevent some of the injuries that could happen because he's tightened a hip or he's tightened wherever his scaps are off, like to prevent it is far better than trying to treat an injury.
100%. And a talking point that is good, because I don't want to make it sound like that is the only thing that you do to prevent it. Titus is a great example. Titus came in, and you and Amy, I wish more people would be able to make that decision to say, okay, we're going to try to prevent some of these things, and then we're going to stick with it. But also then there was a transition of knowledge from you all, the blending of the team that he also had to do mobility training.
Yeah.
So he was getting external care, soft tissue manipulation, movement-based things. And then he was doing his own at-home mobility. He was doing his own hypertrophy training. He was doing his own speed work. All of these things, if we were to just have one piece of the puzzle, you're probably still at as much of a high risk. So it's not just us. It is a larger picture that if you're wanting your athlete to be able to perform at the highest level, even if that's not going to college or to the pros, but perform at their peak ability, they have to be injury-free, but then they have to do all of these other things around it too to get to that point. And that's a little bit older, but even at a young age, you can start to implement some of these things with them to where it becomes just a part of who they are and what they do if they are serious about a sport.
Yeah, and I think that's to have all those pieces. One, the kid has to be engaged.
For sure.
Like if they don't want to do the work at home, it ain't gonna matter if you sign them, hey, you need to work on these exercises to improve your core, if you're not gonna do it. But for the athletes or for the parents that really want to try to prevent some of this stuff, getting a screening and then getting attached with people that are going to hit all areas from, I mean, Ty had someone that was designing his workout programs. He was doing speed work. He had a lot of people investing into him that helped, and everyone played a role. It wasn't just one person. But the earlier that you can set that team up, the better you're going to be, because the more that the strength coach knows the strengths or the issues that need addressed within an athlete, the better. The more the chiropractor knows. Like, all those pieces go together, and I think that's a big part of why Ty ended up being able to do some of the things he's been able to do, because he's been healthy, which means he hasn't had to miss lifts. He's never been out for any length of time for any sort of injuries. So he's able to be consistent with his workouts, which I say 1,000 times, consistency is better than intensity. Working out hard for a week doesn't do you anything. Working out consistently for 365 days, you start seeing changes. So
100%.
all those things are part of the picture, and that's what I think it's so important to find someone like Ben that you can trust, that is going to help you with screenings and programs and be consistent with it, because when something does flare up, it's not the person starting from scratch. Like, you have a history knowing, hey, okay, you had this hamstring back 2 years ago. This is how we treat it. You had success with it. Instead of you jump around from doctor to doctor, get different opinions, and every doctor's different, and some doctors are not good. Some doctors are great. I mean, that's just part of it. Like, not all doctors, not all chiropractors are equal. And I think that's where people assume, oh, well, you went to the same school. Some people got C's. Some people got A's. Just saying. I mean, to give you an example, and this is just, like, I went to 2 doctors that said I needed surgery. Like, flat out, I needed a surgery. Not one, but 2 doctors said, you need to go have this surgery done. I went and had a surgery done. It didn't fix the problem. So then I went to Ben. Ben treated me, released some things, and my symptoms went away. So I legitimately had a surgery because 2 doctors looked at the symptoms, said, hey, we'll just get rid of the symptom. But what was causing the symptom was something completely different. And that's the stuff that's just, not everyone's even, not everyone's equal. And especially with my son, I would not trust my son, my daughter, either one. Love you too, Rube. I'm not going to let them be treated by people I don't trust. And that's where, as a parent, that's part of making sure you find the right people, talk to people that have experience with different chiropractors or doctors or whatever. And it is very beneficial. I just took a left turn. We're going to come back here. That's okay. Sometimes I do that.
Good left turn.
You know, it happens. Sometimes I start talking about, like,
I liked it. I was along for the ride.
The last 2 weeks have been snow cones. I don't know why snow cones have gotten me, but the last 2 weeks have been snow cones. Favorite flavor of snow cones?
Oof.
It's a tough question.
I'm going to say blue, but that's not even a flavor.
It's like blue raspberry.
Blue raspberry. There we go.
I don't know if I've ever had a blue one.
Blue raspberry.
I stick with a purple or red.
I know my kids like the tiger blood from
Really?
the one that goes to the high schools.
I
Yeah,
don't
they're
know.
all about that.
I've never had that one.
That's why I love going to the House Central football games.
Well, we'll start. Jerry Daniels was talking about after Little League games, we used to run and get snow cones
Oh.
out at, like,
Mine was
Hazelwood
always an
Court.
all sport at WeHop Field. Shout out WeHop.
Really?
Oh,
All sport.
an all sport.
Do they make those anymore?
They do not. I'm definitely aging myself here.
All sport.
Yeah. The concession stand at WeHop was on point, though.
Really?
Oh, yeah. Loved it as a kid. Some great memories there.
We should do, like, the
There's
best
a nice
concession
little,
stands
like,
around.
mound of dirt that we used to play in after.
I used to
Parents
remember
probably
that.
loved
But
it.
my favorite concession stand, we're left turn here. Baldwin, they used to have those the
Baldwin
Fritos
was a
with
nice
the chili.
Yeah.
Oh my gosh.
Baldwin was a nice setup. We always
Those are
played night
tremendous.
games at Baldwin. I love
Oh,
that.
that was great. 4th of July. Yeah.
Yeah.
Anyway, sorry.
you're
We're all over the place here. I don't even know where I'm at on this thing. We talked about that. That's good. So let's just say you have a healthy athlete that's been seeing. Like, how often would you like to see them just to make sure you're preventing, check up, make sure nothing's flaring up, no knots, no soft tissue issues?
Yeah. That varies a little bit. If I had an athlete that came in and they told me I want to make this a part of a routine for me. So we'll call it prevention, wellness, whatever word you want to throw on it. It looks a little different in season versus out of season. Out of season, we're probably going to hit a pause button, get a baseline for movements in out of season. Make sure that they're working with a professional, that they're doing things that they need to be doing from a strength aspect, all the things we just talked about.
Yeah.
Make sure they're doing things from a strength aspect. I'm going to give them some mobility drills that I might see, making sure, okay, nutritionally, do you have somebody that you're talking to get your nutrition on point? And then from there, typically for a young athlete, probably between 4 and 6 weeks, if them and the parents have came to me and said, I want to make this a part of the routine. In season, for my high school athletes, is probably going to be a little closer, even if we're not dealing with anything, just because of the load that they're going to put on their body in season. And especially for schools out here, the high school schools out here, they're playing a lot of baseball in a small amount of time. And if you've got a starter who is in high school, it doesn't even matter. So football, you got guys that go both ways. In high school baseball, you got guys that pitch and then go to short. And they're not getting this 4 or 5 day routine if they were at the collegiate level or the major league level.
Yeah, the recovery.
Yes, the recovery is going to look way different. So we're typically a little shorter with our athletes in season. And that looks like 10 days to 2 weeks. And then if they have anything pop up, they call me. And that's where I would say the magic happens, if you will, from keeping an athlete healthy. Now, things happen. I mean, you run into a 90-mile-an-hour fastball into your elbow. There's some things that happen. But the little repetitive nagging things we're able to stay ahead of and keep that athlete optimizing their performance and not risking any repetitive inflammatory injury when we're in season, doing it a little bit sooner. So,
and just staying ahead of it is such a big deal. And the recovery piece is, I think, so overlooked, especially in high school sports, because like I know the softball team at Howe had like 9 games in a week or something. Like baseball, we've played 10 games in a week. And it's like, these are high school bodies that are taking a lot of stress, and they're not getting the sleep they need because they got to be up at 6 o'clock in the morning to go back to school.
Yep.
They're in school all day, then they play, and then we're getting home at 8 o'clock at night. They're throwing in junk food because they ain't got time to cook. Yeah. And the recovery component, it's just hard. And I think that's where having people to stay ahead of it a little bit and be able to sneak in and see you for 15 or see whoever for 15, like that's important to do.
Yeah.
Because there's only so much a high school kid can do. Like, there are limitations. I know people are like, oh, they're kids, they're fine. They're putting stress on their body like we didn't.
Yeah.
Like we didn't play, I think we went to state in like 1991 in baseball. I think we played about 24 games, 25 games.
Oh, right. We were right there with you. Yeah.
So,
and we didn't go to state.
And Ty, the Howell team's played 42 games every year the last 3 or 4 years. Like, that's a lot of games, and it's just a lot on their bodies. But so some of the things that you mentioned them, but just kind of quickly to go through, like cupping and dry needling, like how does that actually speed up the healing process?
That's a great question. So, not to get too deep into the science, but all of the things that I've mentioned come from a very pro-inflammatory scientific backing. So, with Graston, we're trying to increase glide while putting pressure.
Graston's a scraping.
It's a scraping tool. It's like a metal tool. You've probably seen some similar. Some people call it gua sha, or if you go to a PT, it's called A-stem. Anybody tells you it's different, it's not. It's all the same thing. That is a gliding technique with a tool where you're trying to increase, not to be redundant, the glide of the tissue. And research has shown that it may produce like fibroblastic reaction. So you're getting a collagen type response.
You get like a knot in your shoulder and the muscle's not moving the way it's supposed to. Essentially, this is breaking up so it moves better. And I'm talking basic level.
Yes.
This is a baseball.
It's not, and scientifically, we're to get down to the minutia of it. It's not really breaking that knot up. But what you're doing is desensitizing that area. And from a neurological standpoint, your brain is no longer wanting to protect that area enough to have that kind of balling of the tissue, if you will.
It tricks your body into releasing the tension.
Correct. And that is in a larger trigger point. That's when we're going to use dry needling, because dry needling, we can actually go in with an acupuncture needle and then we connect E-stem to it. And so from
Okay.
just like,
That doesn't hurt. Like
No,
the
no.
needles, I've had it done. People are like, I'm not sticking like their acupuncture needles are not the same needles as like you're getting a shot with.
correct. And basically the tissue will uptake that needle. The neurological system relaxes that tissue, and then the stimulation fatigues it to a point of relaxation, and then we can kind of start from baseline. Yeah. So it's not in this like over guarded, knotted tissue response. With cupping, we're trying to basically get blood flow to that area as fast as possible. Yeah. If you don't know, blood is what heals an issue, which is why if you're throwing ice on something in a very local standpoint, from an acute injury standpoint, please stop. The body needs that inflammatory response. Now that's for, we'll say 95% of times, but that's what we're trying to do. We're trying to get blood flow to that area. Now cupping will also create basically like a negative vacuum, which pulls up the dermis, the fascial layer, and sometimes some of the muscle. But when we're able to pull that cup off, you get a relaxing of the tissue. And so these different techniques all kind of fall into the same category, but they all have different applications in certain times. So it's like having not just this shotgun approach, but having more of a bow and arrow approach on a specific issue. You have these tools in the tool bag to use. Yeah. Sometimes we use multiple of them if it's, okay, we got to get this athlete better, fast.
More aggressive.
We got to go more aggressive. Sometimes we'll throw a multitude of things at it.
See what works.
Yeah. And then we also use a class 4 laser at our office, which stimulates growth and healing at a mitochondrial level. So deeper at a cellular level, has a little deeper penetration. And we see the speeding of the healing process through the release of CO2. So you get vasodilation, blood to that area. And we also see like reducing free radicals, free oxidative stress in that area. And the body has a stimulation of the mitochondria, which are kind of like the powerhouse, releases ATP. Okay, I said I wasn't going to get deep, but now we're getting deep. Right. ATP is energy. So then it's going to stimulate your body's ability to draw what it needs to draw to that area to heal it. And so we try to have as many tools in the tool bag, depending on the injury, depending on what's going on, to get that injury calmed down, but then taking a broader approach of, okay, what can we do outside of these areas
to prevent reoccurrence?
Correct. To increase the overall performance and like the ability for that body to move through it, whatever sport it is, the mechanical movement you're wanting it to move through.
And for high school athletes, when they have a hamstring and you treat it and you get them back on the field, but it flares up again, like that's where the reoccurrence of preventing that's the goal.
Yes.
And that's where I think a lot of people just, hey, get me back on the field, I'm good. Well, if it's going to happen again in 2 weeks, it didn't do you much good.
Yeah.
So you said ice specifically to an area, bad, but then you see, obviously, cold plunges is a big deal right now. Ice baths are a big deal. Like, that's a different sort of treatment.
Total different ball of wax. And ice baths typically are going to range from 55 to, we'll call it 35 degrees.
It's cold.
And it's a full body treatment. And there is a ton of research on why we're doing that. But when we're talking about acute injuries and just slapping on an ice bag, that's a totally different ballgame. Yes.
Makes sense. So obviously there's a lot. And the good news is there's no quiz over what he said about ATP energy. I actually knew. I took physiology.
There you go.
So lactic acid and all the other. Anyway.
Yes.
So there's no quiz on any of that. But the good news is there are people out there that can help you get you back on the field, get you there quickly, and get you there safely, and hopefully keep you from reoccurring the reoccurrence of the same injury. So reach out to different chiropractors, figure out what's the best fit for you. But it's one of those tools that you should have as an athlete. I'm not going to lie, like it's changed a lot since you apparently had them at McClure North. I didn't have any chiropractors when I was playing. It was just get on the field, rub some dirt on it, but I'm older. Actually, I'm old. Wow, I turned 50 on Monday.
Really?
That's okay. 50.
That's a big one.
I know, but that's
awesome.
The goal. For everyone out there laughing, being like, oh, you're 50. Yeah, let's see if you make it. So anyway, I've survived 50. That's good. I've earned these years. Anyway, I'm all over the place today. I'm sorry. But look into chiropractic, especially find some that are reliable, reach out to people that use them. It is something it's not the only tool. Obviously, there's a time to go see an orthopedic surgeon. There's time for PT. Like everyone has their role, I just think sometimes, and the reason I want Ben to come on is so that you watch and understand, chiropractors do a lot more, and they are very beneficial. I've seen it personally. Titus, my son, has been treated and really kept him on the field and really prepared him for the MLB combine with the functional movement screening, FMS. That's why you say FMS.
Yes, yeah.
It's not quicker, FMS. And then I sound cool, and everyone's like, what's FMS?
Yeah.
But it helped him when he went there. He's prepared for it. There's a lot of different components to what chiropractors do. So I appreciate you watching. Hopefully you got something out of it, and we will see you next week.